Where does a thought go when it is forgotten? To find an answer to this question had become a lifelong quest for this man. Sigmund Freud, arguably the most controversial man in science history. Born to a Jewish family in 1856 in the Austrian Empire, when he was 4 years old, his family moved to Vienna, which remained his home near his death. He became a doctor in medicine in 1881 at the University of Vienna, specializing in neurology. He wanted to become an academician and had published several pieces of research in his early 20s, but he changed his way out of it because of the discrimination against Jews. Instead, he turned to private practice as a clinical neurologist. In his practice, Freud saw a variety of psychiatric patients, many of them with hysteria. Over a long career, he developed a new way of thinking about these disorders, and he formulated the most famous theory in psychology, psychoanalysis. Psychoanalysis is derived from the Greek word psyche, and analysis is a theory of a therapy technique that basically tries to understand a person's conscious and unconscious minds. The hallmark of psychoanalysis is the assumption that much mental activity is unconscious and that understanding people requires interpreting the unconscious meaning underlying their overt or manifest behavior. It focuses on repressed impulses, internal conflicts, and childhood traumas. At first, like other guys of his day, Freud looked for physical causes in patients. He knew that damage to the brain and nervous system could cause physical symptoms like paralysis and emotional symptoms like depression. But for some patients, there were no physical cause. Other doctors were jumping to the conclusion that those patients were faking it, but Freud thought differently. When he was studying in France, where he stayed for 4 months, he saw doctors using hypnosis to reduce symptoms. Later he met with Joseph Breuer, who discovered that a patient who recalled earlier memories while in a hypnotic trance was relieved of her symptoms when the trance ended. This woman was Anna O, and Breuer needed young Freud's help to understand what happens to her. These experiences converted Freud from a rigid physical model of psychiatry to his dynamic psychological psychiatry. Freud became convinced that unconscious forces have the power to influence behavior, and this is called psychic determinism. Determinism refers to the scientific assumption of cause and effect. Psychic determinism allows psychological factors to be causes. See, before this, everyone thought you should hit a person with a hammer to break him. You needed a physical cause, but Freud claimed a trauma, a cannot seen by eyes psychological factor, can break someone too. There is the conscious, preconscious or subconscious, and the unconscious. Conscious is the awareness, your intentional actions. It includes memories and intentional actions. It functions in realistic ways, according to the rules of space and time. Preconscious is not an awareness at a particular time, but it can be brought to awareness easily. So it includes information that is not at the moment being thought about, but that can be easily remembered if needed. The unconsciousness, however, does not move into consciousness that easily. The unconscious refers to mental processes of which a person is not aware. Such things remains in the unconscious because making it conscious would produce too much anxiety. Its contents are repressed feelings, forgotten traumatic memories, and denied wishes. Everything we do is a result of a combination of conscious and unconscious forces. These may act together so smoothly that a person's actions appear rational, as though consciousness alone determined the behavior. Without the theory of unconscious, they couldn't explain some of these phenomena, like glow anesthesia. In this disorder, the patient has no physical sensation or touch or pain on the hand, in the area that a glow would cover, but the sensation on the arm above the wrist is normal. Weird thing is, there is no pattern of neurons that, if damaged, could produce this disorder, since those nerve cells are connected. If something was wrong with the nerves, the patient shouldn't feel anything from thumb to forearm. Glow anesthesia is physically impossible, yet it exists. So what the heck is that? Freud thought its roots are psychological, since a patient wouldn't know the extension of the nerves and would have thought of the hand as a unit and the arm as another unit. Maybe the person is extremely afraid of spiders and he unconsciously blockades the feelings to the hand to eliminate the possibility to touch a spider ever as a defense mechanism at all. So it is not a neurological disease, it is all in your head. The moral of the story is sometimes there is a symptom or a disease that doesn't make any sense biologically. Freud argued that these are the effects of unconscious motivation, origin and nature of the unconscious. Freud asserted that the unconscious was created primarily by experience, especially in childhood, happens through repression. According to the hedonic hypothesis, we seek pleasure and avoid pain. Those avoided pains are repressed and repressed thoughts and memories are made unconscious. We seek a method for revealing unconscious to test it. Among these projective tests, we can name Rorschach inkblot test, which is asking patients what they are seeing in this inkblot, and thematic apperception test, or TAT. What could have been the story here in this picture may reveal their unconscious. In the second part of this video, we will look at structures of personality, like id, ego, and superego. Also 5 psychosexual stages of Freud, which includes things like Oedipus complex. Also we will learn 9 defense mechanisms against anxiety. Thank you for watching and see you in part 2.